There we go. Okay, tonight's Zoom topic was supposed to be one thing that was going to be really dandy, and we'll try to reschedule it for another time. But what I thought we would do this evening is there oftentimes are questions that go over and over, like in Teresa's Facebook group. The question gets answered so many times, it's almost like we need to have an FAQ section. And so I'm gonna ask Teresa and Carol to participate on some of these things that are more frequently asked questions. We actually are going to have someone come in and talk to us about the clean air devices. I believe I have her scheduled for next week or the week after. But I know that that is on a lot of people's minds as far as when we get back to the office, how can we have clean air? And of course, the biological office would be a safe place to be, provided you have all the equipment. And so, Teresa, I know you were very good about posting 4 different kinds of air purifiers. Would it be possible for you to expand on those 4 different ones?
Sure. Sure. Okay, so the one that I have in my office is the DentAirVac, right? Mike Everett is the one who owns it. He's the one who's always at the IAOMT and IABDM meetings. He's fantastic, right? And then
your TV's in the background.
Sorry, it's not my TV, it's the bank. I'm trying to deal with the bank on top of everything else.
Okay, gotcha.
All right, then the next one that is available is one that also I have seen at the IABDM, IAOMT, and that's that IQ Air one, right? And I've seen that one. And then the third one that I've seen is actually Randall Moore introduced me to it. He owns the Dental Safety Solutions stuff, so the dentalsafetysolutions.com. And it's called the Healthy Air, and it price-wise is about the same as the DentAirVac. So they're both about $1,250 to $1,500, something like that, right? The IQ Air runs, I think, almost $2,000. And then there was a fourth system that came out, and I'm blanking on the name of it, but I put it in the comments in the group.
Okay. If you can find that comment and cut and paste that into here in the chats, it will show up on here, which would be incredibly helpful.
Yeah, sure, not a problem. Let me look for it right now.
Dr. Scott, would that be surgically clean air?
No, so there's aerosol control, right? And then there's air scrubber, right? The aerosol control is the DentAirVac and so on and so forth. The air scrubber is in addition to the aerosol control. Aerosol control is just what's coming out right here. The drill, the Cavitron, everything right here. Does that make sense?
Those as well as, has anyone here on the line applied for any of the small business loans? I know that's what we've started doing.
Okay.
Is turning in the applications for that. Anybody else?
Yeah, that's what we're doing too. Let me see, aerosol. All right.
And so the ones that you're talking about, Teresa, we're not talking about just having one in the office. We're talking about having maybe one just.
Correct. So, okay. So the 3 machines, right, are the DentAirVac, the Healthy Air, the IQ Air, and then the fourth one is called Sentry Air. So I'll go ahead and put all of those in, and they're about equivalent, I would say. You know, they're one of them, I think it's the healthy air, but it might be the other one. One of them says that it offers a UV light. I'm of the surgically clean air is the air scrubber, and it has a UV light. So I'm, you know, I'm good with that. But I will post, where'd you go? There you are. I will post it in the comments for all of the links to all of them. And then the lady who's going to be speaking about scrubbing the air is the one that you've got scheduled, I think maybe on the 22nd or something like that.
The 22nd or 23rd.
Talking about the different, like what the surgically clean air does. And it literally has like 6 different ways that it scrubs the air. It's really cool. We got it before this entire pandemic started, and I'm so glad that we have it. And we got it just simply because we realized that the aerosol control does a decent job, but you know, there's still allergens in the air, and there's still just, and then, you know, as luck would have it, it sterilizes our air too, you know, which is a good thing. So anyway, let me put in the links in the chat.
So another frequently asked questions, you know, can you re-sterilize some of these scrubs and things that are being worn? And of course you can, as long as you have ozone. Then you can create a bin that, you know, you could get a big huge Tupperware container, the kind like you use for storage when you put your Christmas decorations away. You could drill a small hole in the top, enough for an ozone tube to go in there, and then you could put all your gowns and everything. Don't stuff it real full, and then ozonate it for about 5 minutes, and you should be good to go to reuse those items while we're still trying to get more gowns. And of course now we're looking at sewing gowns and having something that will be used over and over again instead of the paper breathable ones that we have. And who knows, maybe that's going to make us go more green on some of those items that we use over. Does anybody have any questions that they would like to ask?
All right, I've got 1, 2, 3 links up there. I'm going to do the Sentry.
Okay.
We'll go from that. This one is just you know, that these are the options available. And then, you know, there's others that are like trying. There's one called the EDS system that I think is honestly just terrible engineering. You know, and they're charging $3,000 for it, right? But it has 4 different 90-degree bends in the arm. You know, the suction arm, 4 90-degree bends. Air doesn't flow in 90-degree bends.
I saw your note about what a poor,
you know, air does not,
is. Yeah.
does not go whoo, whoo, whoo. Air goes, you know, and you should never try to get things to flow in 90 degrees when it's, I looked at that, I'm like, I don't know who engineered that, but that's bad, you know.
It was a guy. So we'll blame them.
Yeah, but what's really funny is all of the ones that I posted about that, you know, that are the IQ Air and all the others, all of them have good, you know, those bendable arms that are more flowy. So I'm like, what the heck were they even thinking, you know, trying to put that on and then charging $3,000 for it, where the other ones are $1,250 to $1,500, and like even the IQ Air is only $2,000. Like, what the heck, you know? So
I see that we have a couple of hygienists on here tonight as well. I want to just make a shout out. Today we launched our biological certified assistant exam, and so if you have dental assistants that you know of, it's a $75 charge for them to become members of the IABDM, but watching the Biological 101 is free right now, and the exam is free. So if you're looking for ways to come back to your employer and say, you know, look, I made good use of my downtime. Let me respond to this, then that would be one good way to do it. They still have the obligation at the end to either write a paper or do a PowerPoint or shoot a small video. Dental assistants, it would be great to have a whole library of things, you know, from how to sterilize something to how to work ozone and get something cleaned. There's a lot of different things that they could choose to make a video on. So I just wanted to let you guys know, please help me get the word out there that the dental assistance exam is up and running as of today. So, and these exams, you don't really have to study for. You've got the question, and then it has links and some articles for you to read to find the answer in. So it's a learning test. You don't have to say, oh, I don't know anything about biological dentistry. This is where you're going to learn about it. Plus, we have a lot of videos online for people to watch. Other questions that are common on your Biological 101, Teresa?
So people always obviously have questions about the right now it's all about the masks and the you know, masks and ozone and the aerosol control. Like right now, that's what it's all about. Typically though, when things are not in emergency mode the way that they have been, what I've noticed is a growth in the comments about nutrition, about detoxification and supplementation. I continue to encourage them to not supplement willy-nilly, to actually see a good doctor, you know, functional medicine, biological medicine, naturopath, who can help them determine with blood tests what their blood actually needs, as opposed to just trying to throw nutrients at themselves. Because I've learned the hard way, you know, I'm a supplement junkie, you know.
Well, and I like that you say that, because we had this discussion, I think the other day, maybe I tagged into one of your rooms and somebody said, you know, I want to take zinc because of the COVID, and how much do I take? And my answer was, you can't just randomly start taking zinc, because zinc is the competitor to iron. So if you take too much zinc, you will make yourself iron deficient. Just like if all of a sudden you see that you have a problem with copper, copper's antagonist is molybdenum. And so you can end up making yourself anemic and still having high levels of iron, really high levels of iron, but you have copper anemia, or you have B12 anemia, or you have B6 anemia. So it's true that you don't want to just willy-nilly take some things that don't work for you. I mean, vitamin C would be a good thing to take. It's self-limiting. Of course, if you take too much vitamin C, then you just get the runs. If you take the liposomal, that doesn't seem to be so bad. I'm curious, has anyone been able to get any, I'm curious if anyone has been able to get any of their vitamin C from Live On Labs. I have not gotten mine, and I've had to outsource to different companies. I will tell you that Professional Health Products has a ascorbic acid that is buffered, and it's really inexpensive. It just lasts for forever. A teaspoon is 1,000 milligrams, and then just mix it in water, so it doesn't have any of the sugar or anything that the Emergency has in it. So that's a really good thing to use. And then Biotics Research also has their vitamin C back in stock. So they have a large capsule called BioC Plus that is something good to use. When we were at the last conference, I got the lipospheric. That was the one that tasted like, I think it tasted like caramel coffee. And fortunately, I bought a bunch of that while we were there, because it's getting more difficult to Emerson Ecologics, yes. But that's the D3K2. The D3K2 I can still get through orthomolecular. Oddly enough, I'm still satisfying a lot of orders from different people and had to replenish stock. So those of you that are just checking in, because I just checked in about 6 of you, our speaker for this evening is on the side of the road with a flat tire and AAA trying to help. And so that's not a good place to be. So this is frequently asked questions, and or if you've got some stuff that you would like to share about resources for different things, that's how we're going to use our time this evening. So you can either choose to unmute yourself and ask questions about anything, or you can use the chat box. I want to reiterate that today was the launch for the IABDM of a certification for a biological dental assistant. So now we have our biological dentists, we have our certification for hygienists, and now we have a certification for dental assistants as well. And it's a learning type test for all 3 of those. Very interesting for me. I've had some people that have said that they want to take the test and they didn't pass the test the first time because they really didn't. They just thought that they knew stuff and they just marked answers. And then when I tell them, you know, take the test the first time, you just send an answer to me. Take the test the second time, you have to explain to me why you changed your answer, and you have to give me a reference as to how you came up with this answer. And so again, it's a learning test, so it's not meant to intimidate, but I also don't want somebody to just think that they can pay for certification. It is actually something that you're going to learn from. Has anybody gotten a good source for masks yet? Like to get, I know we're going to be going back to work and not using paper masks so much, but I would imagine hygienists even are going to be using N95 masks. Here's a response that says air gas, which I'm not familiar with them. So Air Gas is the company? Okay, I'll have to look that up. For those of you that came in at the end, at the beginning of this, we were talking about filtration. Yes.
So Airgas is a local company based out in Dallas, and they usually do med gases, but they also have an online store. It pretty much says airgas.com, and they have a list of all the masks, respirator masks, and the filters. The only thing I would suggest is make sure you're buying the right filters for the respirator. The easiest way to do that is call them during business hours to make sure you're getting the right one.
And now you're not able to try to fit. So how are you trying on the mask? I can.
Okay. All right. So I think the size pretty much is small, medium, and large. So I would pretty much use my glove as a reference point. If you use small hand gloves, then I would order a small respirator, medium, then medium or large. What I did for my stuff is I ordered few different sizes, small, medium, and large, 2 of each, because it's not just me who's going to use it. Others will need it too. So more or less, you may probably end up with 1 or 2 extra, but then, that's only this much you can do. Guess
now,
what?
are these the masks that are for you, meaning this 1 per employee, and with the filters that you can change out on the side?
Yes. These are the respirator masks that are good, not just for organic vapors like mercury, but I'm sure also for aerosols.
And can you tell me about what the cost is?
So I ordered during this time, I think it was roughly at around $200 for 1 respirator mask, which also included the 2 cartridges.
Okay. And do you know how long those cartridges last?
Ideally, you need to be changing those once every 3 months.
Okay.
It also depends on your usage too. Like so far, I used to use it only for mercury removal, but going forward, I don't know if it's going to be standard of care.
Yeah, I mean, it's rough when you look at what your options are as far as a mask and then some kind of shield over top of it, and versus wearing a zoot suit, you know, where it
Yeah.
looks like you're on the moon. And those are expensive too, and they're hot.
Yes, not comfortable at all. But also we have to keep in mind, I think Katie had made a video not too long ago. She has a different kind of respirator mask, which almost looks like a helmet. Like it has a glass. The only problem, they are really good. I mean, they will shield off everything. The only problem is you won't be able to wear your loops with them. So she has the kind of loops that go on the head, like biolumix, that's what it's called.
Right.
But I have a regular one. So for me, what works out is buying something that does not completely cover my face. I still have room for the loops. And then I will put something like a shield, that'll prevent water from splashing into my face.
Yeah, I mean, it really does make one think, and dentistry is going to have to change really a lot from what it was. Not so much biological offices, although we will make our own changes. But
Yes.
the traditional dental office that is maybe a clinic type situation, it's going to be drastic for them.
Exactly.
And honestly, I don't know how they'll be
All
able
of
to
my friends who are still practicing conventional have now,
I'm sorry, have now what?
I agree. So have now gotten some form of, protection in place. They have ordered high vacuum suctions. They've ordered, these respirator masks. So it's I think in a way it's good because they won't see us as those crazy people who wear masks and remove mercury. It's going to be more acceptable.
Yeah. Well, does anybody else have any questions or comments about something that, I know, Carol, it's different there in Canada than it is here? Curious. Oh,
yes,
Carol.
it is different here. I haven't really heard of anything. They just had a documentary, a segment on our evening news, and all they just said was that things are going to change. They're just saying that people they don't talk about the respiration masks at all, but they talk about a mask, the N95, glasses, safety glasses, a shield, and some form of protection over your own clothes. We're still able to wear our own clothes into dentistry. I mean, we all wear type of uniforms such that we don't wear outside of the office, but we're still able to pick our own clothes and wear those. So I'm sure all of those are going to change as well.
Yeah, well, I remember OSHA, like we were talking the other night, many years ago, we wore our regular clothes, and I, wore a suit, a dress suit, and got stuff all over it, but he went to the dry cleaners, and, I didn't really think anything about it. And then scrubs came out, and it was like we're in pajamas to work, so it was okay to wear your scrubs there. But then I remember one of the OSHA times that we had our annual training, they came in and said, no, you have to have a washer and dryer. You can't wear your scrubs home. You have to come in whatever clothes you want to wear, and the scrubs stay here at the office, and you put the scrubs on just like they would be at the hospital, although they leave too with their scrubs on. And then you take your scrubs off at the end of the day and put them in the dirty clothes, and either there's someone that washes it there at the office, or you have a cleaning service that comes in. So I think that they're going to be sticklers about something like that. You either come in and you stick to, I mean, we have washers and dryers there, but they're not used for uniforms. They're only used for the towels and the blankets and things we use on people. So I can see where crackdown would come, or stronger suggestions than what they have right now. I don't know if there'll be fines if you don't do it, but I think the public is becoming more educated, and the public is going to ask for different things. So I know even here, I had to go get an injection in my hips on Friday, and the office that they had absolutely nobody in there other than people in pain. So I qualified for that. And the office was so cold that I asked for a blanket. I mean, here in Houston, it's hot outside, but they had the air conditioner cranking, and they couldn't give me a blanket because of COVID. So I just had to freeze. They had blankets there, but they weren't allowed to give it to me. I mean, I was at a point I was willing to buy the blanket just so that I could use it. But
and now next time that you go, you'll have to take your own blanket or something with you.
Well,
to keep
hopefully
warm.
I won't have to go again.
That would be nice.
That's my hope. But okay, so I know that Teresa is off trying to get her SBA loan, and I saw that one other person just got approved on theirs. Has anybody else had any luck getting through? I know we tried today, and Chase's, it was just one error message after another. So we've not been able to, other than learn what it is we're supposed to fill out. And I'll give you a tip. There's a sheet that you should print, the one that you've got to do some math on your 219 income taxes, and then it asks a few other questions. And that particular page times out. So if you've not gone in and tried to do that yet, you'll get frustrated. So my suggestion is you print that page and go ahead and do all your math. You get everything ready, and then when you come back and you're actually, if you get on and don't get an error message, then you can just plop in those numbers right away. So, well, I'm really disappointed about tonight. I had somebody, I'd like to have somebody lined up if someone knows somebody with myofascia. I do know someone in Canada. I might be able to get in touch with her and see if Lori Smith would speak for us and give us a little bit on that. But this gentleman that was supposed to speak this evening was more on, he has a certificate in body structure analysis. So noticing that one shoulder is too low, or that one ear is lower than the other, looking at TMJ problems, and not necessarily looking at it as a dental like we always think about it, but going more for the musculoskeleton and looking at maybe a trigger point in your butt that's getting knotted, pulling that shoulder down, which is then causing neck pain on the opposite side. Well, let me take advantage of you guys being on here. And I know I do have a schedule for this week, and as far as who's going to be speaking, as long as we don't have technical difficulties like this where the speaker is stuck someplace. Is there, or are there particular topics that would be more than interesting for you? If so, now would be a time for you to unmute yourself and speak now or forever hold your peace, and see if I can find somebody that can get on one of these Zoom meetings and talk to us.
I have an idea of one that I think that would be great to have him speak.
Okay.
And that would be Dr. Anthony Sims. He does this oral appliance that he makes that helps people who have Tourette syndrome and cervical dystonia.
Okay. Now there's somebody else that does that in the DC area that we've had speak before.
That will be him, probably. He's in Maryland.
Yeah, no, it wasn't him, but but I'm certainly open to that. If you can get me an email address, I will.
He's I heard him speak at the IAOMT, and he's fabulous. And he's on like he has YouTube videos and everything.
Yeah, I have to look back to see who we had. And I think it was when we were up in Tyson's Corner, which is up in the Maryland area. And he provided videos of people that had Tourette's and tics, and then you put the appliance in and everything stops.
Mm-hmm.
Just amazing.
Really cool.
Yeah.
Really, really cool, because it's a dental appliance, right?
Right. That's exactly what it is. Anybody else have any wants or desires?
Dr. Don, what about somebody that can speak about, I know Dr. Felix Lamo is going to be talking about airway, but what about the association with young children and large tonsils and adenoids? And then the protocol in Canada is if you go to a physician with a 2 or a 3-year-old that has really large tonsils, they just talk about removing them.
Well, and certainly we could talk to Felix about that, because that would be in his repertoire. But do you mean more like getting an ear, nose, and throat surgeon in to talk about?
Well, just what the protocol would be, because for like a 3-year-old is not going, like we talk about growing the airway for adults, but what do we do for children?
We grow their airway too. We grow their airway too.
There's children's appliances. I don't know that Felix does so many of those children's appliances, but the last couple of conferences we've actually had vendors that are MyoBrace. Is that one of them?
Yes. Healthy Start, MyoBrace, stuff like that. But honestly, you know, that I've been using one for years. Oh, and I have another suggestion for a speaker, and that's a myofunctional therapist.
Yeah, that's what we said while you were gone.
Oh, sorry.
No, that's okay. I think that I'm going to.
And I have a good one.
Okay, well, that's fine, because the one that I have is in Canada, and I know how to get in touch with her, but yours is right here in town.
Mine lives in the neighborhood.
As long as she doesn't have a flat tire.
She's fabulous. You'll love her.
Okay.
She's the one I refer to all the time.
Okay, if you want to contact her, I can tell her what date is the next date up that we have somebody available. Well, I'm sorry about this evening. I do appreciate you guys being on. It was recorded. I don't know how much valuable information was on there, although while you were not there, we did get some information about some masks, going to airgas.com and
nice. Okay.
looking at some masks there. And as always, you guys can email me. I'll remind you that we have a board meeting tomorrow night. Board meetings are open to any member. You just have to be a board member in order to vote. But we love for our members to, you know, hear what's going on and put their 2 cents in. So I guess I'm going to call it an evening then and stop the recording and tell you thank you.
Thank you. Good night.
Bye.
Good night.